Hello, Jimmy.
Hi, sir. Hello, sir.
Good
Nice
to
to
have
see
you here.
you. Yeah.
Good to see you here.
Good.
Uh,
Thanks for having me.
Thank you for coming forward. You're the second person now that we are doing this
Oh,
recording with, so it's always good. Uh,
okay.
just to introduce you, um, uh, so Dr. Jimmy Mathew, who is currently clinical professor of plastic and reconstructive surgery at the Amrita Institute. Um, He completed his MBBS from Thrissur Medical College, went on to do his MS in general surgery, and then an MCH. Um, Dr. Jimmy Mathew is also quite well known for his writing. If any of you watched his videos or his books, read his books, you know that he writes with a sense of humor, but he writes very seriously about topics, and then gives it a sense of humor so that it takes away the bite of whatever happens. So good to have you here, Jimmy.
Thank you, sir. Thanks for that.
So, Jimmy, this video is predominantly to ask doctors about professional stress and how did they cope with professional stress. So, I'm going straight into that question, asking you: have you experienced professional stress? Can you recall a situation where you did?
Yeah, definitely. Right now, throughout my career and throughout my life, I have downplayed that always. Like most doctors, I would say, because I was never comfortable with that aspect of my personality, struggling with work, and no one probably knows that I have been actually on the brink of burnout. I now realize on many occasions, which many of our professionals might have been, may not be an isolated phenomenon. But now I realize, and now I am willing to talk about it because now is the time, I think. And throughout my life, it is like you are in a denial. No? You never tell it out to anybody. You don't want to acknowledge it to yourself even. um, Looking back during MBBS, like most people, of course, it's a tough course, and as a quite a competitive guy, you come in there, and then you have been top of your class for all that time. Most of your school and college and all that, and then when you come, there are a lot of smart people. Then you do start failing exams. This definitely is a very problematic time. I think I had that, there are certain crises which happens, which prompts you to action. That's the way I see it. My crisis point was in first MBBS. So this is something which I have never talked about to anybody till now. It has never come out in any of my stories, nothing. What happened during my first MBBS was that I missed an exam because I could not. It was I was I mean I it was like I was absent-minded enough to mix a university exam, an anatomy exam. So I couldn't. I did not write it. Next day I found out that okay, this was the date, but it was difficult to understand how I did that, how I could do that, because it was two exams, then a gap, and then two exams. So in between I missed one date, so I thought it was the next day. So I was all the time focused and studying and all that. And I did not really realize that I was so stressed. Probably that's the only reason that so stressed and focused. Maybe it's a quirk of my nature also, because I sometimes become very focused and then I can never think about anything else. Everything takes a backseat kind of thing. And this made me okay lag behind uh, I mean, 6 months kind of thing. So this is a extraordinary thing that time because it was a big kind of setback at that point of time. Of course, now people would say think that that was maybe nothing, but then I took a step back, and reassessed the whole thing, and my friends changed a bit. I was always during that top competitive people. I was always with them. Then I found that there are other people also existing who are equally good, equally friendly, equally fun, and they're also nice, and they have abilities, and it is not necessary to be on the top of the thing all the time, because the amount of studies to be done is so vast that you just cannot get a hand on everything. So that was the problem, and that's the problem I think most students face during MBBS. Then I sort of calmed down, and I thought that I'll just study to pass comfortably. More than that, I thought I'll just study the basics to understand what it actually is. Then I found that, okay, that is enough just to get that time, just to get 65, 70%, which was actually top 5% of the class, all the exams. It is enough to study the most basic textbook available. For example, Lawrence and Bennett for pharmacology. That too, that very basic, very basic. Anatomy, again, I was studying Snell. So I had again, I studied that. Like that. A little bit like that.
Jimmy, sorry to interrupt you here. I think you brought in such an important thing about failure and the sense of failure, Jimmy, which I think, as you said, as competitive as we are as pre-MBBS students and then in our first year in our MBBS, that failure, and you experienced that in your very first exam, isn't it?
Yes.
Your very
Yeah,
first
true.
year. So
Yeah, true.
how do, I mean, failure is something that makes people feel even suicidal, isn't it?
Yeah, true.
And,
That
and
is
I'm
correct. That's
wondering
correct.
what helped you to sort of address that sense of failure which you might have experienced?
Yeah, true. I mean, I am not sure exactly why. I never felt suicidal. Never. Primarily because, okay, I could see, I'm one of those people who can always see that at that long course. So I realized that, okay, now I may be feeling very bad, maybe a big setback for me from an objective point of view. But in the long run, say 5 or 10 or 15 years, it's not going to matter. So that I knew that. So that was one thing which I mean, again and again telling that thing. Then the second thing was in that few time 6 months which I had to retake the exam. Then I thought, how can I do it? I mean, constructively. So I started reading, medicine, surgery, pathology, just freewheeling. That was a fantastic thing because and other times I thought I'll just a lot of new friends were there, new classmates. So I thought I'll just go around with them. So I kind of I was never at home. I just all the time I used to go out, then enjoy with them, roam around a bit, and then in the library I used to study a bit of extra third year, fourth year stuff just to make this thing, and that helped me a lot in my later these things. I had a very good foundation for MBBS. That was really something which I could get because of I think that helped me. Plus, my father was a doctor and very supportive family, and no financial stress as such from as a student. So all these, of course, are everybody cannot have. So they were all very understanding. My father was like, okay, I mean, this is like nothing in your life. I know this is a big thing for you now, but it's nothing. And a lot of role models also, because my father's classmates were there. And no one knew. I mean, the best people were somebody who might have failed 3 times in MBBS. So it is not like, so I knew that kind of thing.
So, Jimmy, I mean, I think it's worth repeating what you just said, Jimmy, because one of the things you said was that you developed a sense of the future. So you said, this is a temporary setback.
Yeah, I was very clear about that. Yeah.
In 5 years' time, it's just not going to matter.
Mm-hmm.
And the second thing you did was you stepped back from that sense of competitiveness to say, I'm not here to compete for exams.
Yes.
I'm here to learn something which is broader, and then And the third thing that what I liked is you sort of reformed your friendships and became more rounded as a person.
Yes, yes. I
That's
think all the you have really kind of summarized it so well. And I think that has been some of those foundational things which changed me quite a bit. That MBBS, of course, that is the time when 17 to 25, 23, that period is something which anyway will change you because your brain is rapidly changing at that point of time, probably. And this is definitely one of the things which changed me in all these three things which you uh, told, because I could take a long view. And then I absolutely became non-competitive in that aspect. I knew that that was a totally ephemeral and meaningless, and to play for the long thing. So I even now, whenever I learn something or do something, I see intrinsically, I look at it for that intrinsic value of it, and only the basics. I study only the basics basically.
so Jimmy, I'm going to ask you something which is perhaps a continuation of this. So that you sort of redefined yourself
Yes.
in a sense. How did that help you in your later careers?
Oh, it helped me in my later career a lot. Because when I went, of course, I got All India a good rank. Um, Primarily, I think because of my studying it the basics very well. Even I did not know that I was that good. So I got into All India and Jipmer and I took MS surgery. But that is another thing which I'll again tell back to you. See, I mean, I am not, I'm right now. So it's dangerous to tell it out actually now, and for a lot of people, but I will tell it out because I think I can afford it. Probably surgeries was not such a good um, specialty for me, probably because I might have become much, I mean, might have been more comfortable doing over a lifetime some other subject, like maybe some medical subject, maybe something which I have thought about it is like, maybe subspecialties means maybe medical gastroenterology or something in which there is a little bit of not very risky procedures and some diagnosis, because I was very good at diagnosis and patient managing patients is good. I am okay with that. Or even psychiatry, which I had an interest in that time also. I had a quite a huge interest in psychiatry. So later even studied it formally. That psychology I studied it formally just for the interest of it. But why I didn't take psychiatry? That is one question. So whenever I talk about psychiatry, my father would say, okay, he said, nice man. But he was always like, a psychiatry, that is not a good branch, like that. So it was like, it was seen as a not so glamorous, not so glamorous. Or even some other, I was interested in some other subjects also. But then that, so I feel that a lot of people are playing for that glamour, playing for that prestige more than what their interest or their best suited to. Because took surgery. I could have taken medicine, but I took inspiration from my teachers, like many of them in good surgeons. So I liked working with them. And suddenly I realized that I was quite good with my hands, quite good. I mean, like really good during house surgery. But for being a surgeon, that is only the 20%, Without that, of course, I know without that it is not possible. And if you have very good hands, I mean, naturally, it's a huge advantage. I agree. But the main thing about being a surgeon is being able to take that frustrations, is being very emotionally stable and not getting upset when you have complications or difficulties. I think, I'm not sure. Maybe you can throw more light on that. But most of the very successful surgeons, which I see personally now, who have huge numbers and who are very good at their profession. I mean, I mean, by all our conventional standards, are people who are generally very unfazed by all this, unfazed by temporary setbacks. It just doesn't affect them. They are the best. I'm not saying they are the, I mean, other surgeons are, there are very good surgeons. Even I feel a good, very good surgeon. But I just cannot do the numbers. I just cannot take risk after risk after risk. I'm very careful surgeon. I do not do any take risks, or I am not very excited by doing very new things. Okay, I will try that tomorrow. Never crosses my mind. Has it been done hundreds of times before? Can I watch and ask people how it exactly is done? Then only I will do it. Have I seen it done? Then only I can do it. If am I absolutely sure that I can handle all the complications myself, or are there other people who can? All this should be very pakka. For example, I just cannot work in a district hospital setup now here, or even a medical college setup where you may have to do a lot of very risky things with very little support. That just I cannot do it. So that is one way in which I prevented burnout, by making a lot of wise choices. But coming, yeah,
Sorry to interrupt you, Jimmy, and
yeah,
I'm interrupting you with apologies, just
yeah, no,
because
it's
I think
okay.
you're making such a good point here. So one thing you said is, being a surgeon is not just about surgical skills. It's 20% is surgical skill, 80% is the ability to tolerate frustration, and depending on the risk that
Yeah,
you are willing to take. And I'll translate the risk into uncertainty, because the and I'll also bring you back to this issue about about psychiatry, because psychiatry is a specialty where there's a lot of uncertainty. And again, what the other point you made was that a doctor needs to be, so well rounded in their ability to withstand stress, cope with stress and frustration, and
yes,
also to
yes.
know themselves.
Yes, definitely, definitely. I'm not saying psychiatry is. I know psychiatry is actually very prone to burnout and other things in another way. So I may not be correct in my assessment, but I don't know. I just
Don't worry, Jimmy. I can assure you, the psychiatrist will not take offense.
okay. That's good. Good to see.
Wonderful. So, Jimmy, thank you so much. I think we've sort of come to the end of our time. You made several valid points. I can see 6 of them already. Let's see if our audience can pick up those 6 points.
Yeah, that's correct. And one more thing I just wanted
Please.
to tell you, because I did not complete that question, because that not being competitive, did it help me? Yes, it helped me in Jipmer, and it helped me in other places. Where when suddenly when you go to Jipmer and places very tough, and there are a lot of competitive people, I was just not concerned with that competition. I was just looking at improving my skills. Just I want to learn this. I want to learn this. I want to learn this, like that, and just pass. And that's what I did. I was very comfortable doing that.
So, Jimmy, I'll just re-emphasize that last point you made by saying you competed not with others, you competed with yourself.
Yes, always.
Better yourself. And I think that is something that a lot of doctors need to remember. And perhaps it helps to reduce stress. Thank you, Jimmy. It's
Thank you.
wonderful speaking to you.
Nice to be here, sir.
Thank you.
Nice. Thank you.